Can we have a video, please, after that? Yeah.
Yeah, absolutely. It's become a very important topic, which something we never faced previously in diabetes. We were never had to be skin experts until we started sticking devices onto patients' bodies and realized that how many skin issues have come up. And we've learned a lot from stomatherapists because they've got good information to give us. So have a look at my presentation and I'm happy to answer any questions around that.
Can we have the video, please, now?
This is a very brief introduction to caring for skin with sensors and pumps. I refer you to a very good article by Laurel Messer, who is a diabetes educator in the United States. She has done some very good work, and this is a great summary article on pretty much everything we know around preserving skin integrity with chronic device use in diabetes. So the types of complaints that we get from patients are related to scarring. This is more common with pumps, dermatitis, eczema-type lesions, pigmentation, itching, and irritation and blistering. The irritation is typically related to T-cell mediated hypersensitivity and usually starts around 4 to 6 months after the start of use, so there's a sensitization period. Reaction to chemicals used in the adhesives is believed to be one of the biggest causes of skin irritation. And it's generally described overall as contact dermatitis, more common with continuous glucose monitoring, probably because the device is worn for longer, and it's as a result of the destruction of the skin barrier. So we're all familiar with some of these nasty pictures where you can often very clearly see which device was actually worn. We certainly advise patients to avoid reuse of broken skin or unhealed or irritated areas. But for the most part, removal of tapes is the most important education to give patients, and I try to emphasize this more. So when tape is removed from the skin, any pulling, shearing, ripping, or tugging causes a break in skin integrity on top of any damage that may have already occurred with tape being present. So what we suggest is gentle removal of tapes, so the use of an adhesive remover wipe or a mineral oil such as baby oil is what is suggested, so that the tape can be gently slid off the skin or gently folded off the skin as opposed to ripped or pulled. Clean and moisturize the skin. Vaseline, which is a mineral-based moisturizer and very cheap and easily available, has been recommended by some skin specialists as a good moisturizer. Rest the sites well, that's an obvious, and consider a hydrocortisone cream or something like a fluticasone propionate inhaler to be applied topically to the skin to settle any irritation. But of course, please consult a medical officer before that decision is made. So tape adherence, or making the tape stick in the first place and creating barriers to avoid irritation. Any devices need to be applied obviously to clean dry skin. Don't blow to dry the skin, that adds germs to the whole process, of course. Exfoliate oily skin, that helps the tapes adhere better. Shave if needed, maybe do this a day or two before. Consider barrier wipes, so these create a clear invisible film between the tape that's been applied and the skin, so that there's less irritation caused. Consider a physical barrier, so laying down some tape before you insert the pump set or the CGM. Fixamal and Hyperfix and Tecoderm are all low allergy tapes that can be applied to the skin safely for the most part, but again, everybody's different. And certainly when you're going to apply it to the skin, avoid moisture, so not when people are sweaty, come just out of a shower, having just recently had a shower, and there's still a lot of moisture on their skin and in the air. And if you're going to apply barriers, physical barriers, cut a hole where the insertion of the sensor or the set goes. Don't be tempted to allow patients to inject through tapes and barriers, because you'll get failed sensors and failed sets. 3M and Welland are companies that make very good adhesive removers and barrier wipes, but of course there are many on the market, and I've just given you a few examples of a few, and I'm happy to answer any questions related to this. Thank you.